Hi guys, Rena, Malik, urologist and pelvic surgeon. Today I'm going to be reacting to the TV show The Night Shift. I've actually never watched this before, and I was told that season 3, episode 8 has some urologic activity. So let's watch and find out what's going on.
Pain in the lower right quadrant since this morning.
Hi, I'm Dr. Alexander.
I'm Dylan. Ever heard of FOP?
Yeah, the connective tissue disorder.
That's me.
Okay, so number one, when you come into an emergency room, you usually don't meet the doctor right away. You go through a triage system and the nurses see you, you get your vitals taken, and depending on how urgent your care is, if they're worried about you being, in need of seeing someone right away, then you go right back to the emergency room. But sometimes there can be a long wait. So if you ever go to the emergency room, don't expect to be seen by a doctor as soon as you get wheeled in by the paramedics. It looks pretty uncomfortable.
Okay. Your pain could be from appendicitis, so I've called for
I
surgery.
like how she's examining the left side of the abdomen for an
I
appendicitis.
get them all the time from the FOP.
I'm going to check for that too, but we really don't want to miss an appy. Scott, this is Dylan. He has FOP, which causes spontaneous...
I'm familiar with FOP. Hey, Dylan, I'm Dr. Clemens.
Hey.
Dylan presents with a few hours of lower right quadrant pain, so I wanted a consult for appendicitis.
Okay. All right, Dylan, does this hurt here?
More like here and all the way to my
What do you
back.
think? CT?
I think you should have checked an ultrasound and called a urologist. It sounds more like kidney stones.
Looks like you called it, Dylan.
He's spiking a fever, 102.5.
Okay, if it is kidney stones, they could be infected. So let's get a UA and send off a urine culture.
All right, so a few things here. When someone comes in with abdominal pain in the emergency room and you're suspecting either an appendicitis or kidney stones, the first step is to get a CT scan of the abdomen. So to rule out both of those things or to rule in either of those things, you would get that imaging test. So you wouldn't sit there and tell the patient that we're gonna call a surgical consult before we got the imaging or call a urologist before you got the imaging. Also, the best test to look for kidney stones is a CT scan, not an ultrasound. Secondly, if he's having fevers, this can be a surgical emergency. So when someone has kidney stones that are maybe obstructing their kidney, that can cause the urine to back up into the kidney. And if that urine is infected and can't get through to the bladder and out of the body, it can make even a very healthy person very, very sick. So again, she did the right thing by getting a urinalysis. I'd probably also get what's called a CBC or a complete blood count, which would also tell you if the patient has a white blood cell count or an elevation that is an indication for infection.
If it is the kidney stones that are causing his fever.
Yeah, I know. Surgery. And with FOP, that could kill him. Thank you, Dr. Clemens.
Okay, so I had to look FOP up because it's a really rare disorder. It's called Fibrodysplasia Ossificans Progressiva. And so what that is a rare genetic disorder where your connective tissue is replaced by bone and limits your movements. And so this happens in about 1 in 2 million people. And actually, I found one study that told me that it is actually 3 times more likely for somebody with FOP to get kidney stones than the worldwide national prevalence of kidney stones. So also interestingly, they do have this bone growth that can be triggered by any sort of trauma. That's why they keep saying we have to move him carefully, we have to avoid using a blood pressure cuff, and also going through surgery is somewhat of a traumatic experience and may trigger some bone growth as well.
Hey guys, this is Dr. Park. I've asked him in for a urology consult.
Oh, great. Just going to take a look. Fascinating. I've never seen this in real life. Stones causing moderate to severe hydronephrosis. With the infection, he needs surgery right away.
No.
Excuse me?
I'm not doing surgery. Been there, done that. I'm not into it.
Okay, I think what Dylan is trying to say is that he would like to avoid the risk of anesthesia, not to mention the potential permanent calcification of his urinary tract.
I for sure don't want that.
None of that matters if he gets septic and dies. Endoscopic surgery will minimize bone growth.
Okay, there has to be other options besides surgery. I mean, can we at least consider...
You want
the
my
idea-
opinion, you have it. Surgery now unless you want to risk sepsis and death.
Ooh.
I'm not sure we're quite there yet.
Guys, first of all, urologists are not like that. We're really nice people. So, I think what this guy is trying to say is that if you do nothing to somebody who's completely obstructed like this, you will risk getting septic and potentially death. And that's very, very real. And so he certainly has really poor bedside manner, but this is a real issue and needs to be addressed rather urgently. He also shows the ultrasound. So typically we don't do ultrasound at the bedside. We have them go to an ultrasonographer who will take multiple images of the kidney to identify the hydronephrosis, which is what he's showing here, or any other abnormalities in the kidney. And hydronephrosis is swelling of the kidney, which can be due to an obstruction of the ureter, the tube that drains the kidney that goes down to the bladder.
Okay, there has to be other options besides surgery. I mean, can we at least consider...
You want
the
my
idea-
opinion, you have it. Surgery now unless you want to risk sepsis and death.
I'm not sure we're quite there yet. What about lithotripsy with antibiotics? We use the sound waves to break up the kidney stone, and maybe those smaller pieces pass on their own.
Well, that sounds good to me.
We're wasting time. This infection's only getting worse. I'm going to let the OR know that we're coming.
Wait, whoa. No.
Okay, Dr. Park, can I speak with you outside?
All right, one more thing. So these guys are having this big discussion about options to treat this patient right in front of the patient, which typically you don't want to disagree in front of the patient. You would have this discussion, separately, and then go as a team, as a united front to the patient, because that's kind of good teamwork. Secondly, I would never do ESWL or extracorporeal shockwave lithotripsy in someone who has an active infection. The gold standard and the treatment of choice is to drain the system so that you can get the infected urine out of the system so you can avoid getting septic. This is not indicated at all. And the fact that this is coming from someone who's not a urologist, who really has very little knowledge of urology, shouldn't even be a consideration. So again, I think it's good that she's having them step out to have this conversation, but I don't really agree with what's going on.
Okay, he wants lithotripsy. Why can't we at least try it?
You want me to sit here for a few hours and wait until he's really unstable and then take him to the OR?
If the lithotripsy works, maybe he never even needs the OR. The patient wants it, his pressure's stable, let's try it.
Fine, but his chart will reflect my recommendation. Surgery.
So one, electrocorporeal shockwave lithotripsy, or ESWL, does require you to go to sleep. You can't do ESWL on a patient who's wide awake, so you do need anesthesia to get that procedure. So again, I think they're perpetuating a myth that's not true. This procedure is very intense in the sense that you are basically, in essence, getting hit in the flank or the backside where your kidneys are multiple times with shockwaves, and that can be quite painful, and you can't tolerate that awake. In this particular patient where trauma can cause bone growth, this is absolutely not the right treatment, even if he wasn't infected.
Whoa, you guys wearing enough layers?
This machine used...
So they are wearing lead because during this procedure, we use something called fluoroscopy. And fluoroscopy is essentially live x-rays. And so we will take x-rays to identify where the kidney stone is and then target the shock waves to those x-rays.
This machine uses sound waves to help break up the kidney stone. It's much more likely you'll pass the pieces than one big stone.
In other words, I'm going to pee out some rocks.
It's one way of putting it, yeah.
Jordan.
Usually it's like small dust fragments, really, really tiny, not rocks.
Thanks for not going all end of times on me with that other doctor.
Yeah, he was a bit of a...
He's a dick.
Yeah.
Okay, here we go. Oh. Come on.
What's happening?
This thing needs a complete reboot. Call the company, tell them to send a tech. Let me know when it's all fixed.
Okay.
Well, that blows. Now what?
We get it fixed.
If not, surgery, right?
Don't worry. We'll get it fixed. Okay?
So I'm not sure, I've not used that particular shockwave machine. I'm not sure if that's one at all. But if you have issues with a machine, typically you will have someone on site who can help reboot the machine, call the tech, because it may be at a different time to help you go through the motions to try and fix it. You wouldn't just wait for necessarily a tech to come in, especially if it was like late in the evening or at nighttime.
Is there anything else that you need before I try calling again?
My sanity back. So every time I'm back in the hospital, it's like a constant cycle of shit going through my head. Should have been more careful, should have had more water, should have ordered the salad instead of the 5-alarm chili.
Buddy, you gotta give yourself a break. All right, you can't second guess yourself this much. Trust me, I have spent half my life doing it, and that way, madness lies. All right, I'm gonna see if there's another number that I can call. Son of a... Pressler Pharmaceuticals makes this machine.
Well, great. If that question comes up on Jeopardy, I'm going to be sure to remember. Thank you.
No. I think I know somebody who might be able to help us.
Okay, so one, the quality of life for these patients is relatively poor because they have significant pain, bone growth all the time. When you have kidney stones, what he's referring to is there are things that you can do to prevent getting kidney stones. I've talked a little bit about kidney stones before in my reaction to Friends, as well as my reaction to Seinfeld, but the typically 5 major things I tell patients to do is number 1, hydrate, hydrate, hydrate. So drink lots and lots of water, 2 to 3 liters a day. Number 2, you want to avoid lots of red meats because they can cause you to be in a state where you would be more likely to have kidney stones. Number 3, avoid lots of salt. Number 4, have lots of fruits and vegetables because that increases your citrate level and helps you prevent getting kidney stones. And number 5, avoid oxalate-rich foods. And the most common ones are spinach and rhubarb. If you look at all the different types of oxalate-rich foods, there's quite a lot. So people will say, well, what am I supposed to eat? But I think what you need to realize is if you're eating a lot of one of those items, like if you eat a spinach salad every day, or you eat a lot of nuts, those sorts of things you want to cut back on. But it's impossible to really eliminate all the oxalate from your diet. So yes, there are things you can do to prevent kidney stones, and more specific things you can do if you find out what type of kidney stone you're forming. But in general, in someone who's forming kidney stones and we don't know why, those are the recommendations.
Dylan? It's okay, I'm right here. Hang in there, Dylan. Okay, pressure's dropping. Hang, Levithene's pulse is weak. Okay, he's septic. I need you to page Dr. Park and tell him to meet us at the OR. We gotta get these kidney stones out now.
So yeah, this is what we worry about. We worry about patients getting septic when they have an obstructed kidney stone. That is, again, a surgical emergency. And so when you have this particular problem, you don't get the kidney stones out. You just drain the system. Actually trying to take the kidney stones out or breaking up the kidney stones can cause even worse infection. So in this point, you would just try to drain the system.
It operated 4 hours ago. He wouldn't be crashing now.
Hey, I'm the one who could die on the table. Dr. Alexander was listening to my wishes.
What happened?
He's septic, pressure's dropping.
We're heading into the OR now. Lithotripsy didn't work.
We didn't get a chance to try it. It wasn't repaired in time.
Still an option?
Dylan, your pressure is very low. It's getting dangerous to not operate.
Can we still try?
Yes, we can. It's risky, but it could work.
That's
No.
insane.
No.
You need surgery.
We still have time. If it doesn't work, he's all yours.
I'll be waiting.
Okay. It's crazy. I've heard crazier ideas tonight. Sometimes a Hail Mary works.
If you need to try.
This is absolutely wrong. They are putting this patient at severe danger of sepsis and death by delaying surgery. And so this is extremely wrong. They should not be showing this on network television because it's just 100% wrong.
So how close would you say we were?
Let's just say it's good you passed that stone when you did.
Some high stakes pee.
Hey, Justin, could you take Dylan to recovery?
Whoa, wait, we're done? That's it?
Yeah.
I was kind of feeling like we were like 3 musketeers there or something for a second, you know? All for one, right? We make a good team.
Yeah, we do.
All right, I'll check in on you later, okay?
Okay.
All right, bud.
All right, bye, guys. So long, Doc. Hi, Jocelyn.
All right, well, I'm glad that he passed his kidney stone and recovered seemingly very quickly. Of course, they've made this happy ending. I think the one thing that's nice is they did really kind of highlight the doctors advocating for their patients and what they need. So there is obviously patient autonomy, and if the patient doesn't want to proceed with surgery, that is their right and their choice. However, I think the thing I disagree with is that the other doctors were disagreeing with the urologist, who knows that definitively this is the right step to take for this patient. And the urologist is the one who would be performing the shockwave lithotripsy, not the emergency room physician. So it would be him who would say, yes, I would proceed with the surgery or not. So in this case, what I would do is I would offer relief of the obstruction, and that would be either with a ureteral stent, which is a tube that drains from the kidney into the bladder, and that's an endoscopic procedure, as they mentioned earlier. So you look in with a camera, you pass this little plastic tube that will then be there temporarily to allow the urine to drain around the kidney stone. Alternatively, you could do what's called a percutaneous nephrostomy tube, which is a tube that goes directly from the back into the kidney using ultrasound guidance, and radiology places this, and that allows the urine to drain through that tube outside the body and then alleviates the infection that way. So those are the two options that I would have offered this patient. If he continued to refuse any sort of surgical intervention, you would just treat them medically with antibiotics and hope for the best. However, very likely he would get very septic and very ill and not be able to recover, because there's no way for that urine to get out if the kidney is obstructed. So I hope you guys learned something about kidney stones, and if you have questions, if you've had a kidney stone, make sure you comment below. Let people know what that experience is like. I know it's extremely painful, extremely uncomfortable, and hopefully you are doing better, getting some care from a urologist, and preventing your kidney stones in the future. Thanks so much for watching, and always remember to take care of yourself, because you're worth it.